This joint is a little bit easier. Both these joints are a little bit easier. One, they're much more superficial. There's not a lot of overlying muscle and tissue that we got to get on. So the other thing that's very easy for me to do is to put my finger right on the sternoclavicular joint. So when I start moving his clavicle anteriorly and posteriorly, I'm not really feeling with this hand that's doing the motion. I'm feeling with this finger, how much does that clavicle move forward underneath me and how much does it move backwards underneath me?
You said SC joint and AC.
AC joint. I'm sorry, AC joint. Yeah, we're on the AC joint.
I got you now.
Yeah, you do. You're speaking my language. So now we do. The slide says to pull anterior, but you don't really want to do that. You want to pull anterior and slightly medial. So what you'll do is you see kind of my forearms coming across here, and then I'm going to pull towards my elbow, basically. Okay? On the clavicle. I'm on the clavicle as close to the SC joint as possible. This AC joint. You're speaking my language now. You guys know what I mean. This finger is right on the AC joint line. And then what I'm doing actually with this hand is my thumb is trying to stabilize the acromion anteriorly. Okay? So that way when I pull his clavicle forward, my thumb is keeping the whole thing from pulling with him. Okay? So I've got that there. I'm just kind of palpating with this finger here, and then I'm pulling anterior and medial. Okay? And what I'm trying to do is feel how much anterior movement I get with this finger here. Okay? To do the posterior glide, I'm going to be in the exact same position, but now I'm just going to push posterior and slightly lateral. And I am still going to get an assessment for how much it's gliding underneath this finger. I can do that sitting here on the corner of a table. I can have them sitting down lower below me, might be easier. I can do this laying down if you want to lay down on your back for me. So you have a few options. Now when he lays down on his back and I need his arm at his side, his arm is actually slightly abducted and extended, right? So ideally the best thing would be to have a little bit of a pillow there so I can have that. So I can be a nice therapist and leave a pillow for his head, or I can be mean therapist, take it away and put it under his arm. Okay. Only because he gave me permission, right? Okay. Just because I know we're videotaping there, I'm going to come on this side. I'm going to, again, identify the AC joint, have my finger right on it. I'm going to try to stabilize the acromion anteriorly and posteriorly with my hand. So that's what the C grip is doing. Anterior acromion right on the spine of the scapula, finger right on the joint, and then with my opposite hand I get as close to the end of the clavicle as possible, anterior, medial, posterior, lateral. He has a hypermobile anterior glide. In fact, if you put your finger right there, I'll let you feel it. Hold it right there, and then you'll feel how far out that comes.
Yeah. Yeah.
Now, if he goes posterior, not so much. He's if anything, he might be a little tight posterior. He's got a hyper. I would say that's hypermobile. Okay. All right. That's the AC joint. Okay. Now I'm going to show you the SC joint. I'm going to need a chair. For me, SC joint I always did, by and large, sitting down. Okay. There are 4 directions we talked about, right? Scapular elevation, depression, protraction, retraction. Depression, when we depress the shoulders, that is what movement of the clavicle? Is it an superior glide or an inferior glide? Superior. It is a superior glide. That would require me to get underneath his clavicle as best I can and then start to actually lift it superiorly. This is not generally a motion we run into problems with. Most people are okay with getting their arms down to their side, and we're never really trying to. So this is one of those motions where biomechanically you can see that's the correct motion, that would be the correct glide, but there really isn't a manual technique that we're going to show you that you do to work on that. Okay, so the 3 that we're actually going to do, be thinking about is the inferior glide, because inferior glide is for what motion? Elevation, so whenever the, okay. Also protraction, which is the anterior glide, and the retraction, which is the posterior glide, okay? So we're gonna do elevation, and we are going to do retraction first. Elevation first. I am once again going to find his sternoclavicular joint, and I am going to place my finger right on that joint line. Again, what I want to feel is how much does the clavicle move underneath my finger. The next thing becomes, what is the joint plane for this motion? And in this case, because it is the convex clavicle, it is the concave manubrium, and the manubrium doesn't move that much, right? It's at this angle right here, right? About a 45-degree angle or so, this way. So when I push, I'm not pushing straight down because I'll hit the manubrium just like we were running into with the humerus. I'm actually going to push inferior and lateral, right? So that's going to be the direction of my movement. So again, I'm just going to place my finger on top. I don't really have to worry about stabilizing the the sternum. His rib cage and his whole body is doing that for me already, so I'm just kind of right there. What I do want to do with my thumb as best I can is I do want to get as on top of the clavicle as I possibly can, okay? And then I'm just going to push in an inferior and lateral direction, feeling for how much it moves over this. Now this can be a little hypersensitive on people, so one thing you can do, I mean Kyle doesn't seem to be bothered so much, so that's good. You can get maybe a little towel or even a pillowcase or something around your thumb to give yourself a little bit of padding. The most important thing is that you can feel how much it's moving with this finger here, okay? That's probably the most bothersome, okay, of them. But again, so that's for elevation. For retraction, now the clavicle is concave, so we need to do a posterior glide. So I do the exact same thing. My finger is going to be right on the sternoclavicular joint, and I am going to push the clavicle posteriorly, and I can feel how much that moves there. That one's not so bad, right? This one, yes, that one's sensitive. That's because you got that skin. The posterior one isn't bad at all. Okay. Now this is where the trick comes in. The last one is for protraction, anterior glide. I have to get behind his clavicle and pull it forward, right? The answer in short is yes, right? As if I'm going to assess it that way, yes. But what I'll do instead actually is I'll switch my hands, and actually I will do a posterior glide of the manubrium on the sternum. In doing it that way, and I'm trying to stay out of the way for the picture, but I feel like my hand's right, so I don't want that there per se. But I want to impart a posterior glide of the manubrium, feeling for how much forward is the clavicle coming when I push the manubrium backwards, okay? You have the videos on this too online and everything like that you can look at, but that's going to be those ones right there.